About 2 million people in the United States suffer from severe dementia. Dementia is when a person has a loss of cognitive function due to changes in the brain caused by disease or by trauma. When it does happen, especially in elderly people, it can be a difficult decision for children to limit or even stop their parents from driving. In today's House Calls, Dr. DuBeau, Clinical Chief of Geriatric Medicine at UMass Memorial Medical Center, joins us live via Skype. Doctor, thank you for joining us this afternoon.
Hi, Jen. Thank you.
Well, is there a certain stage of dementia that puts people at a higher risk for unsafe driving?
Usually it's people who are somewhat more advanced in the middle stages, and certainly more advanced dementia, when they really start to be having much more profound trouble, not just with short-term memory, but with thought processing, paying attention to other things around them, or handling a lot of different sort of information all at the same time.
So when should people make the decision about when to take the keys away from their parents or their loved ones?
That's one of the hardest decisions both families face and we face as doctors trying to help families. But there are some warning signs to look for. These include certainly anybody who's had an accident or a near miss, when you've been driving with them and find that they don't pay attention or don't see oncoming cars, particularly from the side, or you've suddenly noticed maybe some new dings on the car. These can all be important warning signs that it may be time, it may be not to take the keys away, but at least to get an assessment.
Are there tests that can be done to find out if a loved one is still capable of driving?
Sure. I think if you have a concern about a loved one, about their driving, the first thing is to make sure they have been to their physician or bring them to their physician to have an assessment, especially if they don't already have a diagnosis of dementia, to find out if indeed that's the problem, or there's some other medical problems such as vision or other neurological issues. For people who are known to have dementia and you have concern about them driving and question whether it's time to take the keys away, there are several different avenues. One is to bring it to the doctor's attention, and the doctor may be able to do a report to the Registry of Motor Vehicles, or families can do that as well, to request a driving eval either from the registry or different hospitals and rehab facilities in Massachusetts do specific driving evaluations, including road tests.
Do you suggest having the conversation with the doctor or just with your parent separately, the child and the parent itself? How involved does the doctor get?
The doctor can be involved to what's comfortable for the family. Sometimes it's easier to have the doctor be literally the bad cop in this problem. There's no mandatory reporting by physicians in Massachusetts to people to the registry. As I said, anyone can make the report, but the physicians are there to help out. And as you mentioned, this is really a very, very difficult thing. I think to bring it up with your parent as a concern is a reasonable thing. It's often with dementia they may not appreciate, or it's a very hard thing because you lose a lot of independence and control over your life if you're not driving. So it is very threatening. And
quickly, where can people find out some information about driving and dementia?
Several places. The Registry of Motor Vehicles on their website actually has an excellent section on mature drivers and a lot of information for people and families, caregivers, about warning signs, how to get testing, some of the there are classes that they offer throughout the state. For people who have a diagnosis of dementia, particularly Alzheimer's, the Alzheimer's Association can be helpful as well.
Okay. Well, thank you for joining us, Doctor.
Okay.
And
thank
we'll
you.
be right back.